Good morning, Haley Gibson here. I am talking to you today about homocysteine. For those of you who don't know me, I'm a functional nutritionist and registered nurse, passionate about helping people get to the underlying root cause of their disease and then helping them achieve that healing goal. Homocysteine, what exactly is that? Well, it is actually an inflammatory amino acid that is derived from a protein called methionine. Now, it's not a dangerous amino acid unless we don't have the B vitamins, magnesium, and zinc that we need to actually facilitate the metabolism and the conversion of this homocysteine product. So today that's what I'm going to talk about. Homocysteine is one of the biggest cardiac indicators we can look at. It tells us a lot about how our vessels are doing and their risk for heart attack and stroke, their risk for breaking down and producing a clot that can make us have a heart attack or stroke. A lot of us could have an abnormal lipid panel, or according to our doctor, a normal lipid panel, or even have like heart pain, chest spasms, things like that, shortness of breath, and we go to the doctor and they say your EKG looks normal, your echo looks normal, your lipid panel looks normal, or your cholesterol may be high and they put you on a statin, which is no good either. So when people start to reach this point, this is when I want us to really dig into, okay, what are my homocysteine levels? This will help us evaluate literally life-saving mechanisms for helping you reduce your risk for a heart attack and stroke. So today I want to talk about testing and give you applicable strategies to take care of your vessels and your heart. So a little bit about me before we get started. Like I said, my name is Haley Gibson. I am a registered nurse and functional diagnostic nutritionist. I work one-on-one with clients and help them achieve their health goals and help them find the underlying root cause of their disease processes. This is a little bit about me. On the left side, you can see a picture with myself and my now fiance and his family. And then below that on the left is myself with my family. And then to the right of that, you can see our dog. I need a sip of water. Sorry about that. So to the right of that, you can see our dog, Rebel. And then you can also see a picture of us at the Mountain Challenge. Huge group of people, fantastic people. I've made a lot of friends doing the Mountain Challenge where we work out together going up the side of Kennesaw Mountain. It's a lot of fun. Alrighty, let's do it. So the problem with homocysteine, you can see in the top right picture here, it's kind of illustrated for you. So homocysteine will actually injure the arterial wall, and then we will have white blood cells and cholesterol come over and try to patch up the wall. And when this happens, it actually creates plaque on the side of the wall. This is going to narrow our vessel diameter, which will decrease the amount of blood flow that we are getting through that vessel. And it also could produce an actual clot. And this clot can either fill up and completely sever the ability for blood to flow through that vessel, or the clot could dislodge and land somewhere, such as the vessels in our brain or our heart or our lungs or our legs, and produce damaging effects. Specifically, if we have a clot land in the vessels of our heart, it's going to block the blood flow from reaching those muscles, and this is called ischemia, lack of oxygen to the heart. And when this happens, we have heart attacks, which, as we all know, are very deadly. Same thing in the brain. If we have one lodge in the brain, we reduce blood flow, and this can result in a stroke. All right, so the problem with homocysteine is that it makes excessive clotting happen. It puts us at higher risk for heart attacks and strokes. Sorry, I've been in Colorado, and I think my voice is still recovering. Alrighty, so you can see here down below I put homocysteine and what all it can possibly be related to, even something such as osteoporosis, cardiovascular disease, of course. Dementia is also being attributed to homocysteine being a factor, not the sole cause, but definitely a factor. The reason being is that if you have excessive plaque buildup in your vessels, you're preventing the amount of blood flow to get to your brain in order to make the processes function that we need to have good brain function. So if we're blocking that blood flow, even just a little bit, it is going to play a role in creating brain diseases such as dementia and Alzheimer's. Pregnancy complications. If we have impaired blood flow to the uterus when we're growing a baby, we're going to have pregnancy complications. So homocysteine, very, very important to know about. So one of the best ways to test for heart function is to look at homocysteine in combination with other factors. Standard medical doctors are doing just a lipid panel, the standard lipid panel, and they look at cholesterol and triglyceride. Yes, this tells us some things. It's useful to know. However, it does not give us a big picture. So we have this cardio power test. You can find it on drjockers.com, and it really breaks it down and looks at the major factors of heart disease. So CRP, C-reactive protein, one of the major inflammatory markers that should be measured when assessing inflammatory levels and risk of heart disease. So studies have actually shown that individuals with elevated CRP have a risk about 2 to 3 times higher than the risk of those with low levels. So if I have elevated CRP, I want to know about this so that I can get motivated and do something about it. VAP test looks at total cholesterol. HDL, which is considered the good cholesterol, and LDL, which is considered the bad cholesterol. It also looks at triglycerides. But in addition to that, it also measures cholesterol subclasses that play important roles in the development of heart disease. So this additional information allows your doctor to improve the detection of heart disease risk from about 40 to 90% and provides a foundation for patient-specific treatment plans. You know, we're not all the same. Unfortunately, the medical field has created, a generalized way of treating. However, we are individual, and our treatment should be individual and customized for each person. So there's also the nuclear magnetic resonance lipoprofile test in the cardio power test. This is an advanced cardiovascular diagnostic test that uses nuclear magnetic resonance spectroscopy to uniquely provide rapid, simultaneous, and direct measurement of LDL particle numbers and sizes of LDL particle numbers. It also measures HDL and VLDL subclasses. So this detailed lipoprotein particle information allows clinicians to make more effective individualized treatment decisions than previously possible based on standard panel testing. So the cardio power test, really great for digging deeper and looking at the multiple factors contributing to heart disease. So the biggest culprit for vessel disease, atherosclerosis, is actually something called LDL particle number, not LDL cholesterol, is what the most updated research is saying. So LDL particles are responsible for carrying the LDL cholesterol. We can actually have a lot of small LDL particles present carrying a small amount of cholesterol, but this leaves the vessels at risk for being injured due to the excessive amount of LDL particles. So even if our cholesterol is low, we could still have too many LDL particles. So if we have low LDL particles, which means few carriers carrying the cholesterol, we are actually at the lowest risk of vessel damage from a cholesterol standpoint, even if our total cholesterol being carried by the particles is high. I know that's kind of confusing, but basically we want our LDL particle number to be low. Elevated cholesterol is not necessarily a bad thing. It could be a protective mechanism. Whenever we have inflammation going on, LDL cholesterol is something that actually gets released in response to try to heal the body because of its anti-inflammatory effects. So really you need someone to sit down with you and go through the testing because it is more in depth than just looking at, oh, your cholesterol is a little high. Why is that cholesterol high? Let's dig a little deeper. What's going on? If it is all diet related, then yes, we need to make changes. So we want larger LDL particle sizes and less in quantity, basically. So homocysteine is from methionine, the protein that I spoke about. And you can get this from meat, eggs, dairy, fish, Brazil nuts, sesame seeds, and several other things. So homocysteine is produced from the ingestion of these foods. Now, these foods have a lot of health benefits, so why would it create something that's dangerous? Well, I think this slide does a really great job of showing us why. So in order to convert homocysteine into antioxidants and enzymes and other catalysts that we need in our body that are really great and helpful for detoxification, for instance, glutathione is considered the biggest antioxidant in the body. It's considered the most needed and the best antioxidant. So homocysteine, if we're not converting, then we're left with this big molecule that damages our vessels. So we need folate, B12, B2, zinc, B6, and something called TNG. So if we're lacking these things from our diet or we're not absorbing them properly, then we're going to see issues with homocysteine buildup, putting us at higher risk for a heart attack and stroke. So methylation is also related to homocysteine, and methylation, plain and simple, basically it is something that our body does thousands of times a day, all day long. It is adding a methyl group to a compound. And this is needed for all of the things you see listed here. It helps turn it on and off genes, so important for cancer development. It's important for preventing cancer. It also helps us process chemicals and toxins, so it helps decrease our toxic load in the liver. We need it to build neurotransmitters. We also need it to metabolize hormones, build our immune system cells, synthesize DNA and RNA, produce energy, and produce a protective coating on our nerves. So methylation is extremely simple but very important. And methylation requires folate and B12 in order to happen efficiently. So if we're lacking folate or B12, we can actually have a disturbance in our methylation pathway, and this can result in elevated homocysteine levels. Another way that homocysteine is broken down is from transsulfuration, and that requires the coenzyme form of B6. So if we're lacking in that, then we're also going to have an elevated level of homocysteine. A poor diet that is high in sugar and carbohydrates can deplete these key B vitamins and magnesium. If an individual has gut dysbiosis, they can have poor absorption of these nutrients, which can result in elevated homocysteine as well. Genetic defects even, such as the MTHFR gene mutation, can cause problems with folate and B6 absorption. So it makes it hard to utilize, and this is often found in individuals with elevated homocysteine. So very important to just know about. If you have a genetic reason that you make elevated homocysteine levels because you're not absorbing these nutrients properly, you need support to help your body be able to metabolize that better. Very important. If my heart disease were related to a B vitamin deficiency, I would want to be able to fix that. It may be that I'm taking a supplement or eating foods high in B12, but I'm not absorbing it appropriately. So very important to make sure that we evaluate things like our stomach acid and gut flora and other nutritional deficiencies that are important for utilizing these. One more thing. So methylation testing. This methylation pathways testing, you can also find it at drjockers.com. This is going to look at everything on this slide, basically methionine, homocysteine, cysteine, cystathione, SAMe, methylation index, and SAH. So basically, we look at what is needed to make one go to the other, and this helps us identify what nutrients we are lacking. Okay, so all right. So blood tests that show homocysteine levels above 8 are an indication of methylation deficiencies and elevated risk of cardiovascular disease. So these individuals should supplement with pre-methylated forms of B vitamins, such as methylfolate, methyl B12, P5P, riboflavin, trimethylglycine, magnesium, and choline. So clinically, I use a product called Methyl Power, which has clinical doses of each of these nutrients and will lower homocysteine levels when the issue is due to B vitamin deficiencies. So Methyl Power, this is one of our go-to supplements for helping people with elevated homocysteine levels or methylation problems, period. So then down below that, another great supplement that we use is called Brain Supercharge. So N-acetylcysteine and lipoic acid are also great supplements to help boost glutathione, that major antioxidant we spoke about, and this helps lower homocysteine levels. High quality omega-3 fatty acids and medium chain saturated fats from coconut oil are also critical players in lowering homocysteine as well. So we have many of these powerful glutathione boosting compounds and mitochondrial enhancing nutrients such as CoQ10 in our Brain Supercharge formula, and that is what you see here. So I just wanted to tell you a little bit about the supplements and what they have in them. So this is myself and Dr. David Jockers. We work together to help patients get to the underlying root cause. We work with people locally and over long distance. We will look at lab reports that you've had done and also help you with choosing the correct test for you specifically. We also help with nutrition and lifestyle coaching. We make customized plans for our patients. So that is a little bit about us. If you have any questions, please email me at nutrition@drjockers.com. Thank you.